Hi viewers, today we'll be looking at health record. We will go a step further to give different instances of keeping health records, the requirements and patient's privacy and storage of patient's medical record. As we had said in the previous topic, medical record or health record are used somewhat interchangeably to describe the systematic documentation of a single patient's medical history and care across time with one particular healthcare provider's jurisdiction. A medical record includes a variety of types of notes entered over time by healthcare professionals, recording observations and administration of drugs and therapies. Orders for the administration of drugs, therapies, test results, x-rays, reports, etc. The maintenance of complete and accurate medical records is a requirement of healthcare providers and is generally enforced as a licensing prerequisite. The terms are used for the written paper notes, physical, image films, and digital records that exist for each individual patient and for the body of information found therein. Medical records have traditionally been compiled and maintained by healthcare providers, but advances in online data storage have led to the development of personal health records, otherwise referred to in short form as PHR, that are maintained by patients themselves, often on third-party websites. This concept is supported by the law and the Health Information Management Association. Because many consider the information in medical records to be sensitive, private information is covered by expectations of privacy, and it has to be ethical to avoid legal issues. Third-party access has to be scrutinized, reviewed, and approval given for its dissemination, storage, and its disposal. Although the storage equipment for medical records generally is the property of the healthcare provider, the actual record is considered in most cases to be the property of the patient, who may obtain copies upon request. Viewers, have you ever required your medical records whereby the hospital will refer you to go online to the website, that is if you had registered as a patient with that facility, to go to your login page and access your medical information? Otherwise, the facility refers you to the medical records department in that facility to go and request for physical copies. Physical copies can be by paper or it can be electronic, served electronic by email, or fed into a disc, a compact disc for you to see. If it's an x-ray, you can see that on a film. So it depends on what the case is and what options are there for you to obtain your medical records. The information contained in the medical record allows healthcare providers to determine the patient's medical history and provide informed care. The medical record serves as a central repository for planning patient care and documenting communication among patient and healthcare provider and professionals contributing to the patient's care. The traditional medical record for inpatient care can include admission notes, on-service notes, progress notes, preoperative notes, operative notes, post-operative notes, procedure notes, delivery notes, postpartum notes, and discharge notes. Personal health records combine many of the above features with portability, thus allowing a patient to share medical records across providers and healthcare systems. Electronic medical records could also be studied to quantify disease burdens, such as the number of deaths from a particular illness, or help identify causes of particular illness or diseases. Electronic medical records could potentially be made available in securely anonymized forms to ensure patients' privacy is maintained. The contents are generally written with other healthcare professionals in mind. This can result in confusion and hurt feelings when patients read these notes. For example, some abbreviations such as shortness of breath are similar to the abbreviations for profanities, and taking time out to follow a surgical safety protocol might be misunderstood as a disciplinary technique. History can range from surgical history, obstetric history, medication and medical allergies, family history, social history, habits, immunization history, growth chart and developmental history for children and teenagers, medical encounters, chief complaint, history of the present illness, physical examination, assessment and plan, orders and prescriptions, then progress notes. If you've ever visited a hospital, you will recall some of those. You'll be asked if you smoked, if you drank, if you've ever had any surgery, what are your social habits, if your family ever had any type of chronic disease or debilitating diseases, any medical conditions. Have you ever visited a place where you have suffered some kind of emergency, which these are captioned as medical encounters, like travel. When you travel, did you suffer an allergy? Did you suffer any illness? So you give a history of what is your current illness, when it started, your symptoms and signs. All these are part of the history that are contained in the patient's records, and these are strictly confidential. Every step on improvement and treatment given to the patient is also recorded in and kept as part of the medical records. So from the first call at the facility to the completion of treatment, this will be recorded and documented. And the facility, in line with government's requirements, would be keeping those informations for a number of years until such a time that is recommended for its disposal or destruction. So viewers, we have come to the end of the summary on health records. Don't forget to like, subscribe and hit the notification bell to stay updated. See you again next time. Bye for now.